Hello, hello, hello. Jess Wonders here. We are going over the course Lifestyle and Move Your Body for pre and post-op. And we are on the part for moving your body, also known as exercise. So I'm going to go ahead and share my screen with you and we'll get into it. All right. Lifestyle and move your body. Who the heck am I? My name is Jessica Wonders. I'm a certified integrative women's health coach. I've got a specialty in endometriosis when it comes to my education, but I am here to empower women to heal so they can live soul-aligned lives of abundance. Let's get into my quick disclaimer. Please take a moment to read this. Educational purposes only here. And my pledge to inclusivity. All right, let's get into the move your body portion of today's presentation. Okay, prehab. This is before surgery. What can we do? It is ideal to begin 6 weeks or more before surgery. Even if you only have 2 weeks before surgery, you can still increase your fitness level to speed up your recovery time. Make sure you are approved by your physician, though, to start exercise before surgery. And you might want to also talk to them about the types of exercises you plan on doing to make sure that it's okay for you to be doing them. Prehab can reduce your need for inpatient rehab, so after surgery. Benefits of prehab: increased circulation and metabolism, faster recovery after surgery, increased general vitality that will carry over into your recovery process. Exercise helps rid the body of toxins and metabolic waste, while recovering your body will expend its energy to heal rather than trying to detoxify. So we want to be as detoxed as possible and releasing our toxins as much as we can in a healthy way. Increased serotonin levels, decreases anxiety and releases stress. Now be cautious of overdoing it and consult with your surgeon regarding health concerns with mild to moderate exercise before surgery. Overdoing exercise before a procedure might present a risk to certain conditions. Always get clearance from your surgeon and be cautious if you have adrenal fatigue. Now, I am using the word exercise because that is what people are most familiar with. However, what this is really about is just getting you to move your body in whatever way that feels good for you. Because if all you can do is walk 1 block or half a block and back, that's good. Let's start there. If being a gym rat and those types of exercises work for you, fantastic. I am not here to poo-poo that. I am just here to say that moving your body is good enough. And in whatever way you can do that, it's good enough. And functional exercise, when I use that term, I am talking about things that are natural to the body, which is not being in a gym environment and not using those tools for working out. It is actually more swimming, going for a hike, moving your body in its natural ways, right? Moving those muscles in an easy way instead of such hardcore way like you see in a gym. All right, let's get into it. Sorry, I went on a tangent. I apologize. I just want all people to understand that I'm not here trying to shove exercise down your throat. And if you are somebody that works for you, that's cool too. Fitness for recovery: strength training, cardiovascular fitness, flexibility training. It's ideal to use all 3 of these forms. Even short walks or simple stretching can enhance your surgical outcome, So yoga, for example, would help you with stretching. Okay, next slide. Strength training. This increases bone density, decreases risk of bone fractures in elder patients, increases strength, energy level, and endurance. Studies suggest it can reduce surgical pain and might reduce potential for developing blood clots. Core training. This is very important for abdominal surgeries. So people with endometriosis, if you're having laparoscopic deep excision, this is for you. Toned muscles have a better blood supply and will heal more rapidly after surgery. It will be more difficult to strengthen abdominal musculature after surgery if there are any major incisions. Try abdominal bracing before transitional movements, proper bed mobility transfers while engaging your core, and coughing while bracing with a pillow. This is going to come in handy, this information for post-op. Okay, specific training. Prior to any lower extremity surgery, if you are needing an assistive device, practice those transfers. Now, prior to any lower extremity surgery, so hip or pelvic, you would encourage abdominal and upper body strengthening with some attention to your legs, specifically your glutes, if approved by your surgeon. If you are needing an assistive device after surgery, it would be helpful to practice walking and using that device, or say, for example, like a crutch. Also, practice going up and down stairs and curbs. Practice transfers with the assistive device, getting in and out of bed, in and out of the shower, up and down from the toilet, etc. Practice doing these things before surgery, right? So cardiovascular fitness benefits. This increases blood flow throughout the body, drains lymphatic congestion, and increases heart strength. Reduce tension. Cautions. Considerations with cardio. Caution if your client, patient, so you, has a heart-related condition. Get clearance from the surgeon. Excuse me, I am just flubbing my words all over the place, you guys. I apologize. Be cautious of overtraining with patients dealing with adrenal fatigue. If you feel worse or sick after exercise, you are overtraining. Let me say that again. If you feel worse or sick after exercise, you are overdoing it. Cardio examples include outdoor walking. This is ideal. Be in nature, get some vitamin D. There's indoor, walking on treadmills you could do. That's available for inclement weather, but it is preferred that you do this in nature outside. That's where the functional exercise piece comes into play, which actually helps with mental health preparation, that sort of thing. Here's an example. Walk at home. There's an example of, so just looking at nature actually helps us heal. So that's an example as to why I want you to get outside. Pool walking or swimming or water aerobics, biking, rowing, dancing. Some people may not be well enough to do too much exercise. So even short walks, like I mentioned before, even a few blocks or a couple times a week can help with post-surgery recovery time. Flexibility training. Yoga and Pilates strengthens, relaxes, and tones the muscles, increases flexibility, strengthens the vital force, allowing quicker recovery, increases blood flow to internal organs and glands, reduces stress, and relaxes both mind and body. Now, a little something here, info for you. Yoga to reduce pain. There was a study in 2011 that documented more than 100 people with low back pain. One group attended a weekly yoga class, the second focused on aerobic and strengthening exercises, and the third read a self-care book on pain. After 12 weeks, patients in the yoga group reported better back function. At 26 weeks, they also reported less pain. Yoga for depression, stress, and anxiety. This is how it can be helpful. Researchers at the University of Utah noted that people who have a poorly regulated response to stress are also more sensitive to pain. The study concluded that yoga, as one technique, can help a person regulate their stress and therefore pain responses. Isn't that cool? Energetic exercise. Neuroscience and sports psychology theorists maintain that by visualizing an outcome repeatedly, the mind can prepare the body more favorably to consciously desired outcomes. That's kind of what we talked about with affirmations, visualizations, meditations. Postures, movements, and exercises that increase flexibility and promote inner vitality and tranquility while balancing the nervous system is what we want to focus on. So things like Tai Chi or Qigong, these two are the #1 doctor recommended workouts with people for people with endometriosis, by the way, or adenomyosis or pelvic pain conditions. Now, this is done in a standing. It involves performing a series of gentle, precise, and fluid movements. So it's like things like this. I'm moving at a sloth pace because I'm pretty sure that that's how you do Tai Chi. I've never actually done it, but I've seen YouTube videos on it. Ooh, it kind of feels good, guys. Maybe I should take it up. I prefer yoga usually. Okay, sorry. All right, so it's done with those fluid movements. These movements focus your energy, create internal and physical balance, as well as promote your well-being. Preparing for surgery, these exercises can help you feel more relaxed, calm, and help you sleep more deeply. Tai Chi to reduce pain. Research shows that Tai Chi can reduce pain and improve physical function, self-efficiency, depression, and the health-related quality of life for knee osteoarthritis specifically. That was a study done for that one in particular. Let's talk about foam rolling. This improves your body alignment, reduces muscle tightness, teaches body awareness, breaks up interwoven muscle fibers, and helps move oxygenated blood in the muscles. This is a type of myofascial release. So if you're somebody who's ever had physical therapy and they've done myofascial work, that's kind of like how this is assisting and how this is working. It's inexpensive and very easy to use. Also, you could take like a towel and roll one up if you don't have a foam roller. That concludes our presentation for today. Let's do a quick little affirmation. I love my body and I take care of it through healthy eating and exercise. I respect my body and am thankful for all it can do. You can find me at jessicawonders.com, endowonders.com, or on social media at Sunfire Poppy. Remember to demand better care, period. Thanks for watching, guys. Have a great day.